the very beginning, Haiti has been an exploited nation.
It seems like there's multiple forces that converge on Haiti that allow it to remain in this position.
They lost everything. And to me, it's mostly very poor people who are trying to do something. Sometimes they will have a small business in the street, which is just like selling a couple of tomatoes to feed the grandchildren or even like the same children that they've been trying to educate.
Starting off as the richest colony of the French Empire, it has now become the poorest nation in the hemisphere.
And some of that is political oppression. Some of it is natural disasters, as we saw in 2010. The earthquake was an absolute devastating phenomenon. The effects are still being felt. It basically took an incredibly impoverished country and further impoverished it. Some of it is directly a result of U.S. policies that served to minimize and eliminate the ability of the Haitians to provide for themselves.
In 1804, for the first time in history, a slave rebellion had been successful and Haiti became an independent country. But France, whom the Haitians defeated for their independence, refused to accept it, and no other nation would recognize their sovereignty. In fact, all the nations put an embargo on Haiti so they could no longer sell their sugar on the world market. So what was the source of huge wealth for the French was of no advantage to the Haitians. They accused the Haitians of stealing their property, by which they meant the people. And they had to pay reparations until 1947, and they became the poorest nation in the hemisphere. In modern times has been the free trade agreement that the Haitian government under Duvalier entered into in the late 1980s. Subsequent to that free trade agreement, the United States began to sell its rice in Haiti without any tariffs for less money than the Haitian farmer could grow their own rice. And their whole agricultural sector was practically destroyed. The poor in Haiti, the majority of the people, are the ones who suffer.
I have tried to really understand what the daily life of a Haitian must be. It is something that becomes incomprehensible. Just as a result of the poverty, they face so many obstacles.
You don't know if you're going to have food, you don't know if you're going to have water. That, I would say, that is the main worry of all Haitians, to be able to make it through that day. It's a day-by-day survival experience. I am very proud to be part of this project.
The needs of the people are being met.
We see many of the conditions that anybody in the U.S. would understand and relate to.
Because of the poverty in Haiti, health care has not been available to the vast majority of Haitian people. He wanted it to be parish-based.
Definitely a community faith-based clinic.
Father John Juice, the parish priest in Haiti, had a dream for his parish. Jerry's dream was to have a clinic that benefited the people of the parish and the whole neighborhood.
The Lasante Clinic was started by the House of Grace Catholic Worker in Philadelphia together with Tom Gumbleton from Detroit. We are all volunteers.
This is one small attempt to make health care available on a neighborhood basis to some of the poorest people in that country. And so the doctors, the nurses, the pharmacists, healthcare agents are all Haitian. And this brings benefit to the community for the health care, but also the money that they're paid, the medicines that we buy in Haiti and so on, contribute to the building up of the Haitian economy, not some outside economy.
The Lasante Clinic has a great value
in this community. It has two major encampments that has been started right after the earthquake. And these people, anytime they have a problem, come by and get appropriate service that we offer.
This clinic, with a very low budget, provides a lot of services: daily consultations, follow-up care, education sessions for our patients while they're waiting, home community outreach work, elderly patients that cannot come to the clinic. We do acupuncture treatments.
Also, we are providing education for 5 women to continue their healthcare education in Haiti.
We're always available. We work together to treat a lot of people.
One of the greatest satisfaction is to see the smile of the patient in the pharmacy.
We have an on-site pharmacy that is open every day.
They have medications that are being served for free.
And they're good quality meds.
I know the fact that I have the opportunity to come to this clinic, I have a little bit of relief from the treatment that I receive here. I can say that I have had a lot of relief from all the pain I've been suffering from. I know this is because of this clinic. Patients will come and feel a little bit of healing because they have someone who can take care of them. To me, that's a lot of progress. We have the health agent who do outreach in the community, and several of them will go with patients into clinic, into hospital for follow-up. We always try to approach it not only with treatment, but also with prevention. That's why I enjoy working here, because it meets exactly my whole ideology to help the people who needs help.
We have at the clinic the essential basic things, but with quality. So we don't have flat screens on the wall, we don't have amazing, beautiful furniture, but we have a good quality staff.
What they receive in Lasante in terms of service is beyond the fact that they don't pay, because the way that the staff welcome them, educate them, is something excellent for them. This is the most incredible thing that this clinic is doing for me, but also for all the other patients who come here. And it takes this very tiny effort to make huge differences in lives of people who enjoy the fact that not only they have access to treatment, but they have access to respect.
Some things do not cost money, and that's one of the things.
One major part of the people who come to the clinic as well is children who are mostly the same children from families who have been struggling. He is really in need for some support to him, because if not, the tumor could kill him at any time. We hope that the next day I will be able to go to the hospital. And when I went, they said they can't do anything for me, because to help me, it will first require some tests. When they told me the price of the tests, I was crying, because there's no way that I will be able to pay for this test. But because of the intervention of Danielle, who was talking to a physician about the clinic to find some help, they accept me to stay at the hospital because the little boy had a very bad fever. So I'm really grateful about this, and my hope is that I will be able to get more support, so at least I can save my only son. I hope that he will live, and if I can get help to make this happen, I will be very grateful about this. And this is very typical when the children come to the hospital. You mostly see this kind of people visiting the clinic from families who've been struggling. They cannot really afford to feed them, or cannot really afford to take care of them, or to pay for an expensive clinic. So this clinic is the perfect opportunity for that. I always say Haiti still matters.
There are dreams out there, but we do need some help to make them come alive.
My wish is that this clinic could be used as a model so more and more people could benefit from this.
All the money we pour into the clinic goes back into the Haitian economy. And so it benefits the country as a whole as well as the individual people who have these jobs.
I so dream that this project can grow so that we can see more patients.
It is always hard to assess the change that is being accomplished in Haiti because we're talking about a country that have been dealing with so much over so many years, and that's why I think it's good at least we have a place like Lasante who can be part of the solution, because I just don't want to imagine Haiti worse than the way it is right now.
And I would like to ask for help for the project to be able to continue.
This is why I would send my best greetings to everyone who contribute to make this clinic possible and explain to them how much it's very important in this community because it's really helping the people.